Ketamine versus SPRAVATO. What's better for you? I get asked this question a lot since I've been treating people with ketamine for several years and with SPRAVATO since it was FDA approved in 2019. I have other videos that go into more detail about ketamine. Ketamine is an old medicine used for anesthesia, but it's been shown to be a fast-acting, effective antidepressant. Treatment centers that use ketamine for depression have reported response rates anywhere from 30 to 75% in those who have failed multiple other traditional medication therapies, sometimes trying 10 or 20 different antidepressants and combinations of antidepressants. But it's not approved by the FDA or Food or Drug Administration for depression. Since it's an old medicine and off patent, there is little financial incentive for a pharmaceutical company to fund a long, expensive approval process that they can't make money on if they do get it approved. It's usually given intravenously, which is the best studied and most common way to give the medicine. There are other ways of taking it though, intranasally, through an injection in the skin or muscle, and even by dissolving it in the mouth. Ketamine doesn't absorb well when swallowed, so that's why ketamine pills aren't used. There have been a lot of studies with ketamine in depression, but these studies really haven't undergone the scrutiny that the FDA gives new treatments, where every bit of data is analyzed and questioned. But we do have 4 decades of use in anesthesia and many years of real-world use off-label as an antidepressant that show it is safe and effective. That doesn't mean there aren't side effects and risks, and I discuss those in other videos. Many people, though, are so impacted by their depression, they don't feel they can wait for scientists and the government to decide whether it should be given that FDA stamp of approval. And it is a medicine that you can get now. Many more people are opting to try it when other treatments haven't worked. And it may never get that FDA approval. Although some drug companies are looking at different delivery systems with ketamine that may give them the financial incentive to get it FDA approved. The limitations with ketamine are that most insurance companies won't pay for the treatment since it's not FDA approved for depression. Because it hasn't undergone the rigorous FDA approval process, there still remains a debate in the medical community as to its true effectiveness. And there are still a lot of unanswered questions about how to give it. How frequently do you need to keep getting it? And if you respond, how do you maintain the benefits? So what's SPRAVATO? Because of the ketamine experience, scientists have looked at ways of tweaking ketamine to hopefully discover a medicine with fewer side effects, particularly the dissociation reported with ketamine, and maybe also to find a way of giving the medicine other than through an IV. SPRAVATO is the brand name, but the chemical or generic name is S-ketamine. Ketamine, like many medicines, is a 50-50 mix of 2 chemicals that are mirror images of one another, R-ketamine and S-ketamine. Think of your right and left hand. While they are mirror images, they're not the same. Chemicals are 3-dimensional, and how they're positioned in space can make a big difference in how they work and potential side effects. So they took out the R-ketamine and left the S-ketamine. Scientists have questioned whether that other mirror image chemical they took out, R-ketamine, really contributes to its effectiveness. Some say yes and some say no. It's being studied now. S-ketamine is more potent than the R and S-ketamine mix in ketamine, which doesn't mean it's better, only that you can give less of the medicine for the same effect, and you can administer it through your nose. It comes in a fixed dose spray bottle and given while supervised by a healthcare professional. SPRAVATO is FDA approved for those with treatment-resistant depression and for depression with suicidal thoughts and/or actions. Usually people who have active suicidal thoughts are excluded from clinical trials, so we really don't know how well medicines work in people who are depressed and actively suicidal. But that doesn't mean it treats suicidal thoughts specifically. It treats the depression in those with those thoughts. While I was a little skeptical initially that SPRAVATO had anything extra or different to offer than ketamine, it seemed at first like it was just ketamine minus the R-ketamine. Since we started giving SPRAVATO in our office, we've seen very positive results. Not in everyone, but in many who have not done well with traditional antidepressant medicines. While it can take up to a month to see benefit, many patients have seen improvement after 1 or 2 treatments. And it's convenient that it doesn't have to be given IV, and it's nice to have FDA-approved guidelines on how and when and where to give. You have to get it in a doctor's office, and the treatment takes 2 hours. You can't drive that day of treatment. So that's the downside. But all that's true for ketamine as well. SPRAVATO is a very expensive medicine, and your healthcare provider has to get paid for giving it to you as well. But hopefully your insurance company will pay for all that. Many insurances have not fully embraced it yet, and there are still many hoops and hurdles to get it paid for. It's getting better, but don't assume if you have insurance it will be covered or that you can get it quickly. We find there could be a long back and forth process with insurances to get them to approve it, which is unfortunate because the people that need it often can't wait. The dosing is limited, so if you develop tolerance to the effects, you really can't go up much on the dose. Also, like many other antidepressants, some people find the benefits may wear off over time. It doesn't work for everyone, and not everyone likes how they feel when they're on SPRAVATO. And you still have the dissociation they wanted to get rid of. But I think, like many doctors, that that's a good thing because we think that dissociation may be an important part of the treatment. I've had many patients start on IV ketamine because it can take a while for the insurance company to approve the medicine, or because ketamine as an antidepressant has been around longer, but they may choose to maintain the benefits with SPRAVATO. So, is one better than the other? I've had patients do better on IV ketamine, but some do better on SPRAVATO, and some the same on either. And some don't do well on either, unfortunately. So I think there are differences in the two, but figuring out who will do better on what remains unclear for now. We don't have any studies comparing the two, but many doctors who prescribe both feel that ketamine may have a bit of an edge. Perhaps because of the IV form, which ensures how much is getting into the body, or because there may be some benefit to that R-ketamine that SPRAVATO is missing. With SPRAVATO being FDA approved, you do have that added reassurance about its safety and effectiveness. So if you're not doing well on your current medicine, don't like how you feel on your medication, or your depression has gotten to the point that you're having thoughts of suicide, you should ask your doctor or get a consultation with a doctor knowledgeable about both to see if you're a good candidate for one or the other. There's no one right answer for now on which will be better, safer, or more effective for you. But check out our other videos that address more details about SPRAVATO, ketamine, and other treatments in more detail.